Welcome back to the Explorer's Life and Learning Hub, where we dive into real health topics that matter, without fear, judgment, or stigma. Today, we're talking about gonorrhea, a sexually transmitted infection that's more common than many realize, but also one that's often surrounded by misunderstanding and silence. Here, we want to share knowledge so that you can take informed choices to care for yourself and others. So, let's explore what really happens when someone has gonorrhea and what you can do to protect yourself and others. What is gonorrhea? Gonorrhea is a sexually transmitted infection caused by a bacterium called Neisseria gonorrhoea. It's sometimes called the clap, a nickname that dates back to old times when the infection was widespread but poorly understood. This bacteria spreads through sexual contact, vaginal, anal, or oral, with an infected person. A pregnant woman can also pass it to her baby during childbirth, as the baby moves through the birth canal. How the infection starts. The infection begins when the bacteria attach to the mucous membranes, the soft tissue lining areas such as the vagina, cervix, penis, rectum, mouth, and throat. Once attached, they multiply and invade these cells. As they grow, they cause irritation and inflammation. Your body sends immune cells to fight the infection, but the bacteria have clever ways to avoid being destroyed, changing their surface proteins so they're harder for immune cells to recognize. This allows the bacteria to survive, spread, and damage surrounding tissues. Who is at risk? Anyone who is sexually active can get gonorrhea, but risk increases if you have multiple sexual partners, have unprotected sex, are a teenager or young adult, are a man who has sex with men. Gonorrhea does not discriminate. It affects people of all ages and backgrounds. The key is awareness, regular screening, and protection. Symptoms, or no symptoms at all gonorrhea, can be sneaky. Many people have no symptoms, which means they can pass it on without realizing it. When symptoms appear, they vary between men and women. In women, symptoms may include abnormal vaginal discharge, yellow, greenish, or bloody, pain or burning when urinating, bleeding between periods, pain during sex or in the lower abdomen. In men, symptoms may include discharge from the penis that may be white, yellow, or green, pain or burning while urinating, swelling or tenderness in the testicles. Gonorrhea can also infect the rectum, causing itching, discharge, or pain during bowel movements. When it affects the throat, it may cause mild soreness or swollen glands, often mistaken for a cold. What happens if it's left untreated? If gonorrhea isn't treated, it can spread beyond the initial site of infection and cause serious complications. In women, the bacteria can reach the uterus and fallopian tubes, leading to pelvic inflammatory disease, PID. PID can cause chronic pelvic pain, infertility, and a higher risk of ectopic pregnancy. In men, it can cause epididymitis, an inflammation of the tube connected to the testicles, which can also affect fertility. In rare cases, gonorrhea spreads through the bloodstream, leading to disseminated gonococcal infection, DGI, a serious condition that can cause joint pain, fever, and skin lesions. Treatment and resistance. Here's the good news. Gonorrhea is treatable. But the challenge today is that Neisseria gonorrhoea is becoming resistant to many antibiotics that once worked easily. The recommended treatment now includes an injection of ceftriaxone, sometimes combined with doxycycline, to also treat possible chlamydia co-infection. Both STIs often occur together, so doctors treat them simultaneously. It's very important to take the full course of medication exactly as prescribed. Avoid sexual activity until treatment is complete. Return for a follow-up test to confirm the infection is gone. While antibiotics can cure the infection, they can't reverse damage already done to reproductive organs, which is why early testing and treatment are essential. Prevention, protecting yourself and others. You can reduce your risk of getting gonorrhea by using condoms or dental dams correctly every time you have sex. Getting tested regularly, especially if you're under 25 or have new or multiple partners. Having open, honest conversations with partners about STI status. Avoiding sex with anyone who shows symptoms until they're treated. The most reliable way to avoid gonorrhea and other STIs is abstinence. But for sexually active people, consistent protection and regular checkups are key. Pregnancy and gonorrhea. If a pregnant woman has gonorrhea, the infection can cause complications such as premature birth, low birth weight, and eye infections in newborns. Routine. STI testing during prenatal care ensures early treatment and prevents transmission to the baby. Early diagnosis, antibiotic treatment, and follow-up are essential to keep both mother and child healthy. Gonorrhea is one of the oldest recorded infections in human history, but with science, awareness, and honest conversations, we can stop its spread. Here on the Explorer's Life and Learning Hub, we believe that understanding your body is the first step toward protecting it. If you learned something today, don't forget to like, share, and subscribe. Together, we can keep building a world where women and men talk openly about health and make informed choices without stigma. Stay safe, stay aware, and as always, stay fabulous. The information shared in this video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions you may have about your health, symptoms, or medical condition.